Hello, I'm John Iskander, and welcome to CDC Public Health Grand Rounds on preventing youth violence. Continuing education credits for public health grand rounds are available for physicians, nurses, pharmacists, health educators, and others. For more information, please consult the Grand Rounds website. Grand Rounds is also available on all of your favorite social media sites. We have a featured video segment on YouTube called Beyond the Data, which is posted shortly after the session. As we say when passing through customs, we have nothing to declare. We've partnered with the CDC Public Health Library and Information Center to feature scientific articles relevant to youth violence prevention. The full listing is available at cdc.gov/scienceclips. Here's a preview of topics for upcoming Grand Round sessions. Please join us then. In addition to today's outstanding featured speakers, I'd like to acknowledge the important contributions to the session of the individuals listed here. And before our session begins today, I'd like to introduce CDC Director Dr. Thomas Frieden.
Thanks very much, John, and thanks, Howard, and to the speakers who are here. We really appreciate your partnership, the work that you do in this area, and the creativity that is being brought to bear on this important topic. Recently, I met a young woman who is in the Teach for America program here in Atlanta. She is from a middle-class family. Both her parents are educated. She happens to be African American, and she's teaching kindergarten in an inner-city school here in Atlanta. And to try to get her students more engaged, she asked them all to think about one thing that they wish they could change in their community. And she thought this would help get them involved. And child after child in this kindergarten said, "I wish there were fewer gunshots because it scares my younger brother or my younger sister. And I don't know how to comfort my younger brother and my younger sister when they get scared when we hear the gunshots." That's the reality of too many children growing up in our communities. And we'll hear grim facts on youth violence today, but we'll also hear some hopeful signs that we can make a difference. Violence, we know, not only leaves the victims who are the direct victims, but also has an enormous impact on families and communities, an impact that continues not only for months and years, but potentially for generations. We recognize that youth violence is far too big a problem in far too many parts of our society. We continue to see 5,000 young people per year as victims of homicide. That would fill 17 auditoriums of the size that we're sitting and standing in today. We also know that non-fatal violence, whether it's fighting or bullying or gang violence, is a serious problem. And it can make children afraid to go to school. It can interfere with school performance. And it's associated with chronic health problems such as tobacco use, asthma, mental health problems, sexual risk behavior, obesity. But over the past decade, we've been learning more and more about the patterns of youth violence and how to prevent youth violence. There are approaches that can be applied at the individual level, at the school level, and at the neighborhood and community level. And partnerships between public health and law enforcement are an important tool to keep kids safe. But preventing youth violence isn't easy. We need to figure out how to target those communities at greatest risk, how to target those programs that have the greatest potential to improve health, and how to document and scale up those approaches. You're going to hear a really excellent set of talks this afternoon from a variety of different perspectives that all approach the fundamental challenge of preventing youth violence and hold real hope that there will be success and progress. And I do think we have lots of reasons for optimism. If you look at the arc of history, youth violence, violence against youth, violence in our societies is declining steadily, is receding into smaller and smaller areas, and is something which ultimately will become less and less common. Our goal, our mission, is to accelerate that progress. Thank you very much.
Our first speaker today is Dr. Howard Spivak.
Good afternoon. I'm Howard Spivak. I'm the Director of the Division of Violence Prevention at CDC's National Center for Injury Prevention and Control. And I'm going to start the rounds today by explaining why youth violence is a critical public health problem. I'd like to share a story of one teenager I met. 17-year-old Tanya had been to more funerals than dances, 16 that she could recall. All were for children, family members, friends, neighbors, classmates. She made this almost unbelievable comment during an interview I was conducting for a public television documentary on youth violence. Tanya was 8 when her older brother was shot during an argument with another teenager from the neighborhood. A year later, her cousin was stabbed to death in an argument at a barbershop over who was next in line for a haircut. An 11-year-old neighbor was caught in crossfire while saying goodbye to her friends. She was moving the next morning to South Carolina to live with her grandmother. 2 classmates were killed while riding their bikes through a park. And so it went. The number of deaths this young girl experienced is truly tragic, but the even bigger tragedy is that Tanya's experience is far from unique. At the time, a colleague and I were traveling the country visiting inner-city high schools. When we asked a class or an auditorium filled with students who knew somebody who had been murdered, every hand would go up. When asked who had lost a family member to homicide, a half or more of the hands would remain in the air. This is life for children growing up in our inner cities. We should keep in mind that youth can be victims of violence even if they are not the ones who are hurt or killed. They can also be perpetrators. And the line between victims and perpetrators can sometimes be blurred, as the circumstances can vary widely. Violence spans a wide spectrum of events and outcomes, from relatively minor to fatal. Homicide is the 3rd leading cause of death among young people aged 10 to 24, and is responsible for more deaths than the next 6 leading causes of death in this age group combined. Homicide is the leading cause of death of young African American males in this country. On average, 13 young people in this age group are murdered each day. Males and racial ethnic minority youth experience the greatest burden from youth violence. Homicide rates are more than 6 times higher among young men than young women, and nearly 14 times higher for African American youth and 4 times higher for Hispanic youth relative to non-Hispanic white youth. Every day, an average of over 1,700 youths aged 10 to 24 are treated in emergency departments for assault-related injuries. In 2012, a total of more than 600,000 young people were treated in U.S. EDs for such injuries. Data on homicides and injuries treated in emergency departments do not tell the entire story about the extent to which violence is harming our youth. Data from the 2011 National Youth Risk Behavior Survey indicate that 1 in 3 high school students report being in at least one physical fight in the last year. 1 in 6 students reported carrying a weapon in the past month. 6% of high school students reported missing school in the past 30 days because they felt unsafe at school or on the way to or from school. The impact of violence extends beyond the immediate risk for injury or death and can persist across the lifespan. Young victims of violence are at increased risk for health risk behaviors such as subsequent violence, suicidal behavior, smoking, substance abuse, and high-risk sexual behavior. Victims are also at increased risk for chronic problems such as depression, PTSD, obesity, asthma, and academic problems. Youth violence is also a major threat to overall community health and safety. Violence or fear of violence can contribute to people spending less time outdoors being physically active and interacting with their neighbors. It can increase healthcare costs, decrease property values, and disrupt social networks. Each year, youth homicides and non-fatal violence result in an estimated $17.5 billion in combined medical and lost productivity costs. CDC's public health approach to violence prevention, a unique niche, emphasizes stopping violence before it happens. The goal is to stem the flow of children entering the child welfare and juvenile justice systems and reduce violent injuries and deaths. The public health approach complements the work of the criminal justice and service systems that focus on children who are at risk or have experienced violence as a victim or a perpetrator. Surveillance to track trends, identify subgroups and locations most affected, and monitor the effects of prevention strategies is a cornerstone of the work in violence prevention. CDC conducts surveillance on violent deaths, injuries, school shootings, and youth risk behavior. CDC also conducts research on modifiable risk and protective factors to guide the prevention strategies. We use that information to develop and rigorously evaluate prevention strategies to determine whether they actually prevent violent behavior. And then we work with communities to build their capacity to use the best available evidence to reduce youth violence. There are a growing number of effective or promising strategies that can be implemented at the individual, relationship, community, and societal levels to prevent violence. Strategies targeting individuals build skills and competencies to reduce risk for violence. Family-based approaches provide parents with support to enhance their communication and problem-solving skills. Community-level prevention strategies involve changes to the physical or social climate to reduce opportunities for violence and enhance social interaction. Societal-level prevention strategies include health, economic, educational, and social policies. Efforts to address multiple levels of influence are likely to be more effective and sustained than those focusing on a single program. Subsequent presenters will elaborate on some of these strategies. We are also continuing to build the evidence base through research. For example, our youth violence prevention centers are allowing us to learn while doing. The focus of the 6 CDC-funded centers is to partner with high-risk communities to implement and evaluate comprehensive evidence-based prevention strategies. These centers have forged local and state partnerships, including with public health departments, to create local surveillance systems to track youth violence and the impact of implemented strategies. They are at the forefront in identifying key family and community causes of violence, testing innovative prevention strategies, and evaluating effects at the community level. You will hear today from Dr. Deborah Gorman-Smith about the work of the youth violence prevention that she leads in Chicago. Over the past 3 decades, we have learned a great deal about what works to prevent youth violence. The challenge is that many communities are either not aware of what works or lack the capacity for implementation. We are actively working to build awareness that violence is a preventable public health problem and build the capacity of local health departments to facilitate youth violence prevention work. Our Youth Violence Prevention Initiative, STRYVE, is providing the help that communities are seeking. For example, we fund 4 health departments to work with partners across sectors, including education, law enforcement, and public policy. They have created data-driven plans using the best available evidence to address local risk and protective factors. They are working to implement and sustain these prevention activities, as well as track and measure improvement. You will hear today from Sheila Savannah from the Houston Department of Health and Human Services about their work to enhance youth violence prevention. Through our work in providing technical assistance to some cities, we are seeing a growing number of successes from the implementation of comprehensive youth violence prevention strategies. For example, Minneapolis is tracking citywide indicators of youth violence to monitor the effects of their comprehensive plan. They have seen reductions in a range of indicators in the past 6 years, including juvenile involvement in violent crimes as suspects, as well as injuries from gun-related assaults and homicides among young people. We are learning a lot from Minneapolis and other cities that are taking a comprehensive approach to violence prevention. Minneapolis has a prevention plan coordinated by their local health department that is data-driven and involve multiple strategies appropriate to their community. They enlisted and aligned a full spectrum of city agencies and community stakeholders in the development and implementation of the plan. They benefited from the technical assistance provided by CDC and CDC-funded partners. They used a set of evidence-based and evidence-informed programs, including strategies to strengthen families, promote and enhance mentoring by caring adults, strategies to enhance public spaces, and community participation. We are increasing the number of cities doing this work by building partnerships and aligning resources with other federal agencies such as the Justice Department through the National Forum for Youth Violence Prevention to integrate public health approaches to violence prevention in existing efforts. You will hear more about this from Bob Lisenby. In summary, the field of youth violence prevention has established a rich and growing evidence base with documented successes and great opportunities to bring this to scale in communities. Information about success stories as well as free training and planning resources are available on our Veto Violence website. Thank you for your interest in preventing youth violence. Our next speaker is Dr. Deborah Gorman-Smith.
Good afternoon. I'm very pleased to be here today to talk about how partnerships between researchers and communities are advancing the science of reducing youth violence, as well as how those partnerships are making a difference in the lives of youth and families living in high-risk neighborhoods. As you've heard, youth violence is a significant public health problem, but one that is preventable. Decades of research has resulted in the development and identification of a growing number of evidence-based approaches that have been found to result in significant reductions in violence, as well as reductions in other risk behaviors. These programs are provided in the different contexts and are designed to affect the different levels of influence described earlier. For example, programs delivered within schools, with families, and targeting neighborhood and community risk have all been found through rigorous evaluation to result in significant reductions in crime and violence. Universal school-based violence prevention programs are the most commonly used prevention approach. A systematic review of these programs by the Task Force for Community Preventive Services found these programs, on average, result in a 15% relative reduction in youth's violent behavior. For example, life skills training teaches anger management and conflict resolution, and has been shown in several trials to decrease the incidence of fighting and delinquency by 40%. Community-wide reductions in youth violence can only come from comprehensive strategies that address broader risks. Business improvement districts are one promising strategy. These are public-private partnerships that invest resources in local services and activities such as street cleaning, security, and adding green spaces to increase the appeal and use of the area. A CDC-supported evaluation of this approach in Los Angeles found a 12% drop in robberies and an 8% drop in overall violent crime. Not only do we have programs that work to prevent youth violence, but these programs come at significant cost savings. And these cost data are being used to guide decision-making about programs and policies. For example, the Washington State Institute for Public Policy conducts comprehensive cost-benefit analyses of evidence-based programs and policies, weighing the cost of the program against potential savings, like reductions in crime and healthcare cost savings. The Institute has calculated the cost benefits of 6 youth violence prevention programs that have been rigorously evaluated and have shown significant and sustained preventive effects, and found that the benefits for each far outweigh their costs. These benefits range from about $3 to $49 in savings per dollar spent. While we have a growing list of approaches that have been shown to significantly decrease youth violence, there are a number of addressable obstacles that impede the realization of this goal. Evidence-based strategies are underutilized. Many interventions and practices are not effective, yet they continue to be used. They're used because those in the field are not aware of the evidence, but also because it's simply hard for people to change or readjust their practice. In addition, most research attention, and thus the most success, has been found for programs that focus on individual behavior. While these programs are absolutely one part of the strategy, changing individual behavior alone is not likely to lead to population-level change. We need prevention strategies that also address community and societal risk. CDC's youth violence prevention centers are helping some of the nation's most violent communities stop youth violence before it starts. These centers are models for how we can overcome the obstacles by using evidence-based approaches and how a public health approach can create real and sustainable change. By creating local and state partnerships and prevention capacity, these centers support communities in bridging the gap between research and practice. They're working within communities to assess local needs and assets in order to identify which evidence-based approaches are needed, working to build comprehensive and coordinated approaches that address multiple levels of risk. They're providing training and technical assistance both in implementation of evidence-based programs and in evaluation. They also inform our nation's broader prevention efforts by sharing our experiences and knowledge with other communities. I'd like to now talk about some of the work of the Youth Violence Prevention Center in Chicago. The centers were asked to focus efforts within one target community. In focusing our efforts within one community, we considered 3 primary factors. The first being the rates of violence, looking at crime and violence across the city of Chicago. Second, in a highly segregated city like Chicago, we wanted to concentrate our initial efforts in a neighborhood that had some level of ethnic and racial heterogeneity. In Chicago, when looking within disadvantaged, high-risk neighborhoods, that means primarily African American and Latino residents. And finally, we were looking for a community that had existing resources and potential, what we might think about as seeds of violence prevention. Seen here is a map of violent crime in Chicago in 2010, the year the center was funded. Violent crime includes homicides, aggravated assault and battery, and aggravated criminal sexual assault. The areas in red are those with the highest incidence of crime, more than 400 per square mile. Our target neighborhood is outlined here in blue, a neighborhood called Humboldt Park. This is one of 18 communities in Chicago whose violent crime rate is over twice the city average. In this high crime neighborhood, shooting and homicide rates are actually 3 times higher than the city average. There are approximately 37,000 residents living in the community. 13% of the population live below poverty, compared with 18% in the city of Chicago. We had some familiarity with the neighborhood and schools because of previous work we had been doing within the schools. And importantly, we had a growing list of community partners interested in and focused on youth, and they brought additional knowledge about the neighborhood. With the goal of population-level decrease in violence, at the community level, we are implementing Ceasefire, a public health approach that includes multiple components, the most well-known of which is the work of violence interrupters, those working to interrupt the transmission of violence through conflict mediation. Our intent was to address both the immediate problem of those already involved in committing the violence and also to look upstream, earlier in development, at those who are most at risk for becoming involved. Evidence suggests that family-focused programs have the strongest and most sustained impact. We're implementing 2 evidence-based family interventions, both focused on high-risk children and families as identified through the school. Both focus on improving parenting and family functioning with the goal of decreasing youth aggression and violent behavior. Both are delivered with the goal of increasing networks of social support among families, as well as families' use of those supports. Safe Children focuses on families with children in 1st grade to help them get a good start in school, and Great Families focuses on 6th grade youth and their families, a particularly risky developmental period before youth become more seriously involved in violence. Early results are showing significant reductions in homicide in the target community between 2010 and 2013. We saw a 50% decrease in homicide in our target community during a period when the murder rate in other violent communities and Chicago as a whole changed relatively little. If we extrapolate these results to the 17 communities with the highest rates of violent crime in Chicago for the same period of time, there would have been the equivalent of more than 100 fewer murders. Beyond the numbers, of course, are fewer funerals, less trauma, and a safer community. We're also seeing significant reductions in violent crime as a whole. The figure here shows significant reductions in violence. These results are consistent when compared with a propensity score match set of similar communities, all other police beats in Chicago, and all other police beats where ceasefire was present. These findings are robust and suggest that this is not just a ceasefire story, but represents the synergistic effect of all the center activities. We expect these trends to continue as we and others continue working in the community, as high-risk youth and families age, as other social service agencies, because of our collaboration with them, begin to evaluate and implement programs based in the best available evidence, and continue to develop a workforce trained in prevention. These results and the results from the other youth violence centers are pushing the field to think about a comprehensive public health approach to prevention of youth violence. A major strength of the center program is that we're learning about how to do this in different types of communities. We're also finding some consistency across centers that can be used to guide further work. For example, in high crime neighborhoods, we need interventions like ceasefire to address the immediate problem of violence, but these cannot be the only strategies. At the same time, we need to implement evidence-based strategies to change norms and attitudes within schools and neighborhoods. We need to implement programs earlier in child development to prevent behaviors that lead to the need for interventions like ceasefire. Centers provide a unique opportunity to both build the science of preventing youth violence and, by working with organizations already in the community, implement strategies that work and see substantial public health impact. I've highlighted today just a few examples out of a growing list of school, family, and community-based prevention strategies that have been demonstrated to significantly reduce youth violence. Seen here are 3 helpful resources that communities can use to learn more about the evidence for existing programs and to consider which will best meet their own needs. Thank you very much. Our next speaker is Sheila Savannah.
Good afternoon. I am Sheila Savannah, a division manager at the City of Houston Department of Health and Human Services. I will be sharing with you how CDC's STRYVE initiative is helping us design and implement a comprehensive youth violence prevention strategy. Houston is largely contained within Harris County. This area has 4.2 million residents, over a quarter younger than age 18. 1 in 3 of these youth live in poverty. Houston is sprawling. It has 22 school districts, the largest of which serves over 200,000 students. Our young people come from very diverse backgrounds, with over 90 languages spoken in our jurisdiction. As we work to prevent violence, these are some of the community factors we must consider. Homicide is the leading cause of death for young people in Houston. In 2012, 85 youth were murdered. In 2012, there were over 14,000 referrals of youth under the age of 18 to the Harris County Juvenile Justice System. 14% were for felony offenses. Even before youth violence is evident in the homicide or justice data, young people are telling us that violence has a significant impact on their lives. 2011 Youth Risk Behavior Survey data indicate that over a third of Houston high school students have been in at least one physical fight in the past year. 14% have carried a weapon, like a knife, a gun, or a club in the past month. Many of our youth have safety concerns and experience violence at school. For example, 12% report missing at least one day of school in the past month because they did not feel safe at school or on the way to and from school. This percentage far exceeds the national average. Young people know how violence affects them and can point us to solutions. So in 2010, the Houston Department of Health and its partners surveyed youth age 11 to 18. Youth were significantly to feel more safe at home than in their neighborhoods. They were also more likely to contribute to family than community activities. Over half the youth reported not having safe places to go or programs to participate in. In reviewing these results with our youth leaders, we concluded that young people in Houston feel disconnected from their community and neighbors. They want to find ways to improve their communities but don't know how to get started, and have few structured out-of-school activities. Houston has a long-standing commitment to addressing needs by working together, involving youth to identify solutions, and improving systems by focusing on strengths rather than only on risks. Much of this philosophy was forged in a 5-year SAMHSA System of Care grant, which was guided by a multi-agency board that included youth and parents. A 2009 examination of the children's mental health needs included an introduction of a public health approach and the importance of prevention. This work positioned us well to use the CDC-funded STRYVE project to apply a public health approach to preventing violence. The STRYVE Award helped us apply core public health functions to the problem of youth violence and catapulted existing partnerships and activities forward in several ways. We are connecting multiple systems and aligning activities to prevent violence. We are combining data from multiple sources like police, schools, and youth-led community surveys, and using this data to guide our approaches. We are using the STRYVE tools to develop a comprehensive prevention plan and select evidence-based strategies that are consistent with our collective values and resources. We are using STRYVE technical assistance to implement our selected strategies and to evaluate the effectiveness of our approach. We began our prevention planning and implementation in Police District 14, which is comprised of 5 neighborhoods. We're starting at the neighborhood level so that we can learn from a focused implementation and evaluate our impact. This initial step will inform our future work in other neighborhoods. We selected Police District 14 because the overall violent crime rate among youth aged 16 years and younger is more than 75% higher than the violent crime rate for the same aged youth in all of Houston. This community also has higher rates of teen births, sexually transmitted infections, intimate partner violence, and chronic disease. To guide our planning and ultimate implementation in Police District 14, we asked neighborhood youth to identify the reasons for violence and who in the neighborhood could best help. We convened other partners, like faith-based community and local foundations to provide more data and help us map neighborhood assets. The data enabled us to identify 3 interrelated and mutually held values to improving outcomes for local youth. By connecting youth voice and health to youth safety, we began to establish a comprehensive violence prevention plan that was strength-based. We could also mobilize a larger partner base that included non-traditional partners who recognized their role in violence prevention. Building on these values, we used STRYVE technical assistance and tools to consider the many evidence-based programs alongside community practices. This allowed partners to shift their resources to evidence-based strategies. STRYVE technical assistance also helped us develop a common evaluation method and as part of our comprehensive plan. One prevention strategy in our comprehensive plan is youth empowerment solutions. We began implementing this evidence-based program in October. We already have 8 partners and 118 participating youth. We will expand to at least 15 sites this summer. For some partners, this is their first exposure to an evidence-based program. This experience is increasing their capacity to select and implement science-driven strategies. As we roll out this strategy, STRYVE tools are helping us to gather implementation data. This information will help us understand the local barriers to using evidence-based curriculum and identify solutions to support expansion. Another evidence-based strategy included in our comprehensive plan is crime prevention through environmental design. By deliberately enhancing visibility, managing access, and properly maintaining physical spaces, we can reduce fear and opportunities for violence, enhance a sense of ownership, and promote positive social interactions. This strategy was directly responsive to what our youth and communities called for and builds upon years of similar activities by our public works and police departments. Through our leadership, we have added participation of youth and residents to build community cohesion and new partners to help expand and sustain this work. Participating youth are now working with us, property owners, and their schools to better use community spaces. While we are very early in implementation of our strategies, we have developed an evaluation plan that will help us measure our impact across multiple levels. With CDC's help, we have identified data sources and set baseline and anticipated targets. We will measure impact on our youth, such as reductions in violence and increases in their assets. We will also measure broader effects, like changes in criminal activities surrounding the schools, perceptions of safety among youth and residents, and environmental factors, such as illegal dumping and community development investments. In Houston, we have learned that while youth violence presents dire facts, prevention is possible. We have seen that a strength-based methodology improves partner engagement and the development of a comprehensive approach where all groups can see their violence prevention role. We have learned that when we listen to youth, they can guide us and give insights on how to make their neighborhoods and communities safer and healthier. Houston is proof that communities don't need to start from scratch. We have learned from other cities, health departments, and federal public health on how to select evidence-based strategies and approaches and how to put them in place. We believe that public health departments have the skills in assessment, data analysis, planning, and policy that are sorely needed to make a significant difference in national rates of youth violence. Public health can and should be a key leader and voice in violence prevention in every community. Most importantly, we believe that youth violence can and should be prevented. We're bolstered by the CDC's investment in public health departments and bold collaborations with the Justice Department, which will be described by our final speaker, Robert Lisenby. Thank you.
Good afternoon. I'm Bob Listenby, Administrator at the Office of Juvenile Justice and Delinquency Prevention, which is a component of the U.S. Department of Justice. My remarks will examine youth violence from the Department of Justice's perspective, how the department is addressing youth violence in our communities, and where we go from here. Reducing youth violence in our communities is a top administration and Department of Justice priority. In 2001, the Office of Juvenile Justice and Delinquency Prevention commissioned the National Academy of Sciences to examine what research is telling us about adolescent brain and behavioral development. In June of last year, the Academy released its final report, Reforming Juvenile Justice, a Developmental Approach. Reforming Juvenile Justice offers recommendations that can transform how policymakers, practitioners, and researchers address the needs of youth who are violent or who are the victims of violence. As Reforming Juvenile Justice makes clear, research on adolescent brain and behavioral development is expanding what we know about the processes of growth and maturation that are ongoing during adolescence. Simply put, adolescents are on the path to adulthood, but this transitory period between childhood and full maturity presents its own unique challenges for the juvenile justice community. Adolescents are not yet adults, but throughout history, the justice system has treated them as if they were when they offended. Adolescents differ from adults and children in three important ways. They have underdeveloped impulse controls, heightened sensitivity to peer pressure, and less ability to consider future consequences of their actions. Research on the impact of various state policies have also emphasized that we cannot treat youth the same as adult offenders if we want to stem the tide of violent crime. For instance, the Community Prevention Services Task Force has examined whether policies that facilitate the transfer of young people from juvenile to adult criminal justice systems helps to reduce future violence. The task force's systematic review resulted in a recommendation against the transfer of juveniles, citing strong evidence that these laws and policies are associated with an increase of subsequent violence. An increase of 34% in violent rearrests was found for transferred juveniles compared with youth retained in the juvenile justice system. The transfer of youth may also result in other violent outcomes, including an increase in pretrial violence, victimization of juveniles in adult facilities, and elevated suicide rates for juveniles incarcerated in adult facilities. We have learned that juvenile transfer policies are counterproductive to helping us reduce violence by young people. The National Survey of Children's Exposure to Violence found that 60% of this nation's children have experienced or witnessed violence, abuse, or crime in the past year. And almost 40% of American children were direct victims of 2 or more violent acts in the past year. 1 in 10 children was a victim of violence 5 or more times. Youth violence often stems from a complex interplay between an individual child and his or her peer group, family, and community. The consequences of early trauma are significant and can actually change brain physiology and functioning. Ongoing violence, abuse, and neglect can derail a child's physical, cognitive, emotional, and behavioral development and increases the likelihood of that child becoming a perpetrator or a victim of later violence. Reduce a child's exposure to violence, and you reduce the likelihood that that child will become violent. Young people who respond to trauma with violence often come to contact with the justice system. Equally important, through assessment and proper treatment, we can heal children who are traumatized. We know that many children are traumatized by violence, but we also know that others are resilient and are not traumatized by the violence they experience. Resilience is an area that deserves more examination. At the same time, research suggests that most youth in the juvenile justice system are themselves the victims of violence and trauma. For instance, one study of juvenile detainees in the Chicago metropolitan area found that of the study sample, 93% of the youth had experienced at least one trauma. Furthermore, 84% had experienced more than one trauma, and 57% were exposed to trauma 6 or more times. At the Office of Juvenile Justice and Delinquency Prevention, our goal is to shrink the juvenile justice system. Partnerships with public health and others in communities are critical to ensure that effective early prevention strategies are fully implemented to stop youth violence before it happens. Young people should travel only as far into the system as they need to get the help they require. When young people enter the justice system, we must provide the support that helps them become contributing members of their families and communities. This means screening and assessments, appropriate treatment, and services for every child who enters the system. At the Office of Juvenile Justice and Delinquency Prevention, our focus is on a developmental approach, trauma screening, trauma-informed care, and evidence-based programs to reform juvenile justice systems throughout the nation. Traditionally, the juvenile justice system has dealt with the aftermath and consequences of violence, and to a lesser degree, its prevention. The focus has been on seeking justice for victims and accountability for the offenders. Over the past decade or so, the juvenile justice community has begun to rethink its response to youthful offending. States and communities are reconsidering their youth crime suppression policies and practices. Local jurisdictions are beginning to look more closely at the circumstances that lead youth to offend and engage in violence, and therefore bring them into contact with the justice system. The Office of Juvenile Justice and Delinquency Prevention embraces this rising tide of system reform and transformation at the state and local levels. These ideals are captured most aptly in the Attorney General's National Forum on Youth Violence Prevention. The forum brings together teams from 10 cities to share their experiences and information about evidence-based practices and to develop comprehensive plans to reduce youth and gang violence. Mayors, public health professionals, law enforcement officials, educators, community and faith-based groups, business and philanthropic leaders, parents and teens from each city work together to develop violence prevention strategies tailored to the local needs. These teams identify ways where they can make better use of available local funds and resources to address community violence. They build multidisciplinary partnerships for planning and program implementation. They improve data sharing and analysis, and they work together to implement local violence prevention strategies. The forum encourages its member cities to change the way they do business and to share common challenges and promising strategies across the child welfare, juvenile justice, law enforcement, and educational and other domains. The goal is comprehensive, multidisciplinary planning and coordinated action. The communities use data-driven, balanced approach, one that emphasizes prevention, intervention, enforcement, and reentry to reduce youth violence. The forum isn't about providing new money. It's about maximizing existing resources. We've gotten support for this effort from the highest levels in every participating city, and the administration's commitment begins with the White House. Addressing community violence is too big a problem for any one department or one agency to tackle alone. The forum members continue to enhance their internal coordination and collaboration. This is as true of federal agencies as it is each of the communities. The message to the forum that the forum is sending is that youth violence is not inevitable. Our collaboration with public health and Centers for Disease Control and Prevention specifically has been invaluable in multiple ways. This partnership has helped us to reframe youth violence as not just a law enforcement problem, but also a public health problem. Doing so broadened the discussion beyond reducing violence to emphasizing the promotion of health and well-being. The addition of public health data also provides a more complete picture of the problem and potential solutions. The public health focus on early prevention and the rich evidence base of prevention strategies is complementing the juvenile justice work. In the process, we are transforming juvenile justice. The Attorney General has often speaks of violence in our communities as a public health problem, that left untreated becomes a public safety problem. Viewed from this perspective, any comprehensive solution we develop must marry public health and public safety components. We cannot arrest our way out of community violence. A broader, more nuanced approach is required. Juvenile justice and any other professionals who work with children should be trained to spot trauma when they see it and to get the child to the care he or she needs. Upon intake into the juvenile justice system, every young person should be screened and assessed for trauma and receive proper treatment. I believe we are at a crossroads. We must embrace the vision that youth violence is preventable. The solutions to violence are within our reach.
We can now open up the floor for questions. I have a couple of guidelines. One is please ask single questions and not multiple ones. Ask questions rather than make comments. And try to speak up loudly so folks can hear you.
From our from our online audiences, how do you encourage other non-targeted communities to get involved?
I'll start on this, but I suspect others will have comments as well. One of the directions that we're taking our work is to build our capacity to provide technical assistance so that we can actually work with a broader spectrum of communities to do this work, to provide tools for them to be able to use to make decisions, to understand data and how to collect the right kind of data, and to identify the right programs for their communities. What we find is many of these communities want to do this work, but they're not sure how to. And so technical assistance support is really one of our long-term strategies to bring this to scale and to build this to a broader network of cities.
I would add that one of the reasons that we've had success with the forum model is that we've gotten buy-in at the highest political levels in the city. You need the principal politician, be it the mayor or the chief legislator in an area, to decide that they have a commitment to bringing about change. When their commitment is expressed, then all the other department heads and professionals engaged in the juvenile justice system, the educational system, Department of Welfare system, public health, and so forth, agree to participate. We need them, along with the universities and other academicians, to help us understand what a comprehensive multidisciplinary system looks like, and also, when you get started with it, how to begin to develop the tools to evaluate progress in each individual community.
Again, from our online audiences, as a school resource officer working in a school, what can law enforcement and faith-based organizations do to connect with youth outside of school?
I think the faith-based partners are essential both inside the school and outside so that it's a continuum. I think really the more community residents, including the faith-based community, volunteer inside the school, they can expand the kinds of evidence-based programs available in school time programs, and then those same partners can construct programs that give young people a place to go out of school. And so that way they know trusted adults in both environments. I think that's really essential.
We know that mentoring works. We know that there are some well-developed mentoring strategies. We know that the length of time involved in mentoring, a year or more, is often critical. We understand the screening techniques for developing mentoring programs. So I would encourage people who want to get involved with youth outside of school to get engaged in a well-developed mentoring program using evidence-based mentoring techniques and practices. That's first. Second, I think everybody who is involved with children needs to understand adolescent development. If we don't understand the way children's minds develop, we cannot understand how to engage them properly. We often think we're doing the right thing when research shows us that we're making really some horrendous mistakes. And we need to be able to look at what we know about adolescent development and implement that in terms of new practices and new programs that are effective, evidence-based where possible, and even promising approaches. But we need to develop these programs and ideas around what we know about adolescent development.
If I I'm sorry, there's also shifting thinking around policy related to this, and there's a growing movement to stop schools from suspending kids because we just end up losing them. It's not like they go away, we just lose access to them. So there's an increasing effort to keep kids in school or keep them connected in some more identifiable way. And suspension is no longer considered the prime response to kids who are acting out, but more there's an effort to understand why these kids are acting out and how to engage them.
Question, is there any evidence that shows that improved nutrition and physical exercise, bringing that back into the school system, has any sort of measurable effect on youth violence? Thank you.
I'm not sure there's much of a database on this. There is a general feeling that the elimination of those kinds of programs has led to more kids getting lost in the system because they have no place to succeed if they're not strong academically. So there's growing interest in reintroducing these programs to allow a broader spectrum of opportunities for schools to be places where kids can succeed and not just fail. But the actual impact of this has not been yet well studied.
I'll just add that I think that there are some studies going on that are starting to look at the relationship between these factors. I think if we look across problems and we look at the programs that we talked about today and also the risk and protective factors that we talked today, we see that addressing those will not only impact youth violence, but will impact a whole range of behaviors and support kids in multiple contexts. So we know those things are linked. I think it's just not clear right now exactly how.
Okay, first of all, thank you for your presentations. I'm Frank Lu. I'm a health economist in the Injury Center. So as a health economist, I'm always interested in the impact of economic policies on health outcomes. So my question is, do you think the recently proposed minimum wage increase would have any positive impact on youth violence prevention? So for your information, so if it passed, the federal minimum wage would increase from $7.25 per hour to $10.10 per hour.
That's a really good question.
I definitely think that, even though I don't have the economic data, I do know that employment is essential in these communities. I think the issues of youth employment is a part of the solution, and I think when we've talked about multi-sector kinds of strategies, the employment and the workforce has to be a partner that can be brought to the table as well.
There are relationships between the economy and a whole spectrum of forms of violence, not just youth violence. So it makes sense that if you, in fact, improve the economy, and we have some examples of that, like the Los Angeles Business Improvement Area, that if you do invest in economic development, and I don't see why that wouldn't include minimum wage as part of that, would significantly affect that. So the relationship between the economy and violence is very real. The solutions for improving the economy to impact on violence is an area that we're continuing to pursue and investigate.
I would add this. One of the things we know is that children who've been exposed to violence are often traumatized. One of the things that we've really never done in this society is screen every child who comes into school to determine whether or not they've been exposed to violence. And if they have, determine whether they've been traumatized, and if they have, get them proper trauma-informed care. We also have not trained teachers and everybody else who comes in contact with children what a child who's been traumatized looks like. We know we have extensive domestic violence in our society. We know we have extensive violence in our society. Until we've addressed the problem of trauma, I think we're missing out on one of the best tools we have available to us to really address youth violence. I have worked with children extensively, and one of the things I found is that I have been able to provide them housing, to work for them to get jobs, to have them have a safe place to stay, a caring adult, and all of that has not really reduced their involvement with the juvenile justice system. So I've wondered over and over again, what is it that there is about children that keeps them coming back to the juvenile justice system? And one of the factors certainly is that we have not addressed the trauma that they experience early in life. We know from the ACEs study also that trauma at an early age goes on and affects your entire life. You can be in your 60s and 70s and be impacted by trauma that you experienced as a child. So we as a society have to grapple with this fact, and we have to come up with solutions, and we have to heal our children by getting the proper trauma-informed care.
Another question from social media. Most juvenile justice entities do not include nor see parents and youth playing a strong and active role as critical collaborators. With the goal of promoting violence prevention, maintaining public safety, reducing delinquency and recidivism rates, and building stronger communities, what is the Office of Juvenile Justice and Delinquency Prevention's commitment to violence prevention strategies that are family and youth-driven?
The Office of Juvenile Justice and Delinquency Prevention is committed to family engagement and youth engagement in the juvenile justice system. To date, we have not advanced the specific policies that will be implemented because we're still researching them. We just received our recommendations from our Juvenile Justice Federal Advisory Committee on Juvenile Justice 2 weeks ago. We plan to research them carefully and make sure that the kinds of policies that we are advancing can be thoroughly institutionalized in the juvenile justice systems across the nation to the extent that the states want to adopt the policies that we recommend. But we want to be careful to make sure that we advance policies that are reasonable, practical, and that can work. In addition, we have done extensive work on family engagement. The Office of Juvenile Justice and Delinquency Prevention has had multiple listening sessions across the nation, has produced a paper on family engagement, and we've talked to the experts on this issue for some considerable time prior to my joining the office. We are at a point where we hope during the course of this calendar year to introduce policies specifically on family engagement.
Yeah, I would also like to add, and I think Houston is a great example of this, that it's very clear that the engagement of both youth and families in this work is crucial, and that community buy-in is very central in this. It's very hard to introduce effective programs if communities don't own the programs, own the problem. And so I think that's a question that goes well beyond what is the juvenile justice system doing to what all of the systems are doing in terms of engaging children and families in this work. And I believe our time is up.
Let's have a big round of applause for these excellent speakers. Thank you very much for joining us today for Public Health Grand Rounds. Please join us again in 4 weeks. Thank you.